Good evening, friends. You are welcome to Saspandan TCM Academy. Namaskar. I am Vivek Rane, practicing acupuncture from last 35 years. So today's is the very important subject we are discussing. So nowadays, everyone is suppressing the emotions. Everyone. They are suppressing angers. They are suppressing revenge. They are suppressing sadness. So if you want to cry, you cannot cry. If you want to dance, you cannot dance. If you want to laugh, you cannot laugh. If you want to hit someone, you cannot do that. Okay? Everyone is suppressing their emotions. And because of this suppressing emotions, effect on directly goes on the liver. So liver chi is stagnant. Liver is hyperactive. मैं बोल रहा हूं अब सब जितने भी अभी ये काल में सबका लिवर अभी हाइपर एक्टिव है, सबका। कोई हर कोई इमोशंस सप्रेस कर रहा है। अगर लिवर हाइपर एक्टिव होता है, सो वी आर डिस्कसिंग द पैटर्न्स liver yang rising. Liver yang rising. Okay, let us take the help of the whiteboard. We are discussing acupuncture. Acupuncture for liver yang. Liver yang rising. This is our today's subject. So let's discuss diagnosis according to Changpu organ. So according to Changpu organs, patterns with the pattern ascending liver yang. So pattern's name is the ascending of liver yang. Ascending of liver yang. Friends, if you able to control the liver yang, so you will manage more than 90% of disease. Okay, so today we are discussing the how to control, how to sedate the liver yang, right? See, liver is very young in its dynamic and therefore already has a tendency to ascend. So liver chi is already have the tendency to ascend. So if there is a deficiency of yin when it goes up, if there is a deficiency of yin or an excess of yang in liver, first deficiency of yin, व्हाइट बोर्ड दिख रहा है सबको? प्लीज रिप्लाई. ओके, व्हाइट बोर्ड इज विजिबल ना? ओके, थैंक यू, थैंक यू. प्लीज चेक योर नेटवर्क. See, liver chi is very young in its dynamic and therefore already has a tendency to ascend, means uplift. So if there is a deficiency of yin or the excess of the liver yang in the liver, okay, its chi will be rise upward. Liver chi will be rise upwards and yang chi has a expansive nature. Always remember, yang chi has an expansive, expansive nature. Yang chi have expansive nature. So this means that the symptoms of the ascending liver yang are always expanding or tender in nature. So when there is the liver ascending of liver yang, always expanding, and there is a tender, there is a painful condition. Okay, the symptoms will typically happen suddenly and they will always be related to factors such as the stress and emotional influence. It is because of stress. So that is the stress and emotional influence. That is suppress emotion, suppress anger, suppress sadness. So all emotional suppression, it causes the liver chi ascending the upward. Wind is part of the liver yang. So there will be an overlap between liver wind symptoms and the sign, and those seen when there is the ascending of liver yang, ascending of liver yang. And there is also marked similarity between ascending liver yang and liver fire, with many of symptoms and sign being the same. The difference between these two patterns is the presence of heat. Okay, these two patterns, ascending of liver yang and liver fire. Okay, so it's the presence of heat. The treatment of these two patterns will be acupuncture in mostly the same. So acupuncture point protocol is same for the liver yang and same for the liver fire. So let us talk about the etiology. So how it start. Okay, etiology means how it start. Okay, so ascending liver yang is never seen alone. So liver yang ascending, liver yang rising is never seen alone, but it will always be combined with the other liver patterns of imbalance. It is correct to say, we can say that the ascending liver yang has its root in the liver indeficiency. When there is the liver indeficiency, so when liver in deficiency, then liver yang will be ascend. So it is the liver indeficiency conditions where the deficient liver in is unable to control and liver yang comes. Liver yang ascends. So it is important to keep in mind, you please keep in mind that liver blood is part of the liver in. Liver blood is part of the liver in. Therefore, the etiological factors that are applicable for both liver in deficiency and liver blood deficiency can have significance here. The liver in deficiency developing from the purely deficiency pattern to a deficiency excess pattern will require a presence of other factors that cause liver yang to ascend, such as the consumption of the substance that are the warming or ascending in the energy. For alcohol, for example, alcohol and strong spices. If patients, that person taking everyday alcohol and he's always eating the spicy food, strong spices, so these symptoms will become. Also, anger cause chi to rise. So, anger प्राण शक्ति को बढ़ाता है, ची को बढ़ाता है. Anger cause chi to rise upward and can therefore be causative factor. So because of chi goes upward because of anger, so its causative factors manifest. Accumulation of the stagnant chi in the liver, as in the case of liver chi stagnation, can force the liver yang to rise. Again repeating, accumulation of stagnant chi in the liver, as in the case of liver chi stagnation, can force the liver yang in rise. So whereas the liver chi stagnation are there, then liver yang be rise. This means that the etiological factors such as the frustration, irritation, and depressed emotion can also have the consequence here. Stress is the frustrating and can cause chi stagnate. Stress, because of stress, so chi will be stagnant. At the same time, being stressed is something that the consume kidney in and thereby after liver in. Kidney in and liver in. Kidney is the mother and liver is the son. When mother is deficient, obviously son will be deficient. So cruel cycle can soon develop. Okay, so this the दुष्ट चक्र हिंदी में बोलते हैं दुष्ट चक्र a cruel cycle can soon develop. So when liver yang is excessive, liver yang is excessive, it will consume an injured liver in. The more deficient liver in is the less able to control the liver yang, which then become excessive. When liver in is less, okay, less, it is a very little liver in, or the more deficient, liver in is deficient. So is the less able to the control the liver yang, which then become liver yang will become the excessive. There is a big difference in how ascending liver yang imbalance manifest themselves, which depend on how deficient liver in is and how excess liver yang is. For some clients, their liver in is just too weak to control the liver yang. In other, liver yang is so excessive that it will require a very healthy liver in part to control it. Okay, so इसलिए लिवर इन स्ट्रांग चाहिए, इसलिए किडनी इन स्ट्रांग चाहिए. Okay, so there will usually be a clear dominance of the ascending liver yang in younger clients due to their in still being relatively strong and their liver yang becoming excessive due to their lifestyle and diet. Older people, on the other hand, have a tendency to more independent. So there will be greater deficiency part in their ascending liver yang conditions because older people have the kidney indeficiency. Okay, when people are growing above the 70, 80 years, so there will be kidney indeficiency. Okay, so kidney indeficiency obviously comes liver indeficiency. So these patterns comes. Difference between how much deficiency and excess there is will influence the treatment strategy. Okay, the more liver in deficiency there is, the more focus there will be on the treatment in the nourishing the liver in. So when you want to nourish the liver in, the more liver in deficiency, when there is the deficiency of the liver in, you have to nourish the liver in. Okay, equally, if the ascending liver yang is the dominant part, there will be more focus on the training and controlling liver yang. Draining means sedating. So you should focus on the sedate and control the liver yang. Okay, these are the two parts. And how you identify there is a liver yang rising. So symptoms and sign. It is a hemilateral headache. hemilateral headache. That is the throbbing in nature. That hemilateral throbbing headache. Then pain behind the eyes. Pain behind the eyes. Pain will be throbbing or distending. And there will be dizziness. Dizziness. Dizziness, tinnitus, ear ringing, and deafness, unable to hear. Irritability, irritability, aggression, aggression, and quick temper, sudden temper, and anger. And anger. So these are the symptoms and sign of the liver yang rising. And also there is a insomnia disturbance, sleep disturbance, insomnia, and voice can be shouting white, shouting voice, and with a harsh tone. Okay, so and there will be hardness, hard and tense muscles. Hard and tense muscles. So these are the signs and symptoms of the liver yang rising. The eyes may appear fixed and gazing. Okay, eyes are fixed and gazing. And if you see the tongue may have swollen inside, swollen and side, swollen inside. Okay, and red in swollen inside and red inside, or red marking along the side. And if you see the pulse will be wiry, and especially on the left gone position. And main symptoms are headache, irritability, and wiry pulse. Now, then what is the treatment principle? Treatment principle will be descend and control the ascending liver yang. Okay? Sedate, sedate and control the liver yang rising. And acupuncture point, write down one by one. Acupuncture point, liver 3, triple armor 5, Li 4, GB 20, GB 21, GB 38, and GB 43, DU 20, and UB 18. Okay, write down the points. Okay, liver 3, triple armor 5, Li 4, GB 20, GB 21, GB 38, GB 43, DU 20, and UB 18. Okay, so and use this needle this point with the sedation method. Sedation. All points should be sedated. Now let us discuss why we should use this point. So what will be effect on our liver yang rising for this point? Okay, so we choose this point because of liver 3. So let us take first liver 3. Liver 3 ascends the liver yang. Sorry, liver 3 descend. Liver 3 bring down the liver yang and nourish the liver in. और liver in को बढ़ाता है. liver in का वो nourishment करता है. liver 3 very important point. It is the distal point. Okay, liver 3. Then Li4. First point liver 3. Second Li4. Okay, Li4 plus in combination liver 3. This spread liver chi. So this combination Li4 in combination with the liver 3 spread liver chi and thereby soothes the liver. Triple armor 5. Next point, triple armor 5. Triple armor 5, drain liver. Triple armor 5, drain liver. Liver yang. And especially when symptoms are manifested in the Shao Yang channel. What is the Shao Yang? It is the gallbladder. Triple armor and gallbladder, Shao Yang channels. Okay, so there is the headache, migraine headache on the Shao Yang channel. So always use the triple armor 5. Then GB38. GB38 and GB43. It's drain liver yang from the head, especially when the symptoms manifest in the gallbladder channel. When the migraine headache on the gallbladder channel, okay, gallbladder channel travel zigzag in the head area. Okay, so always mostly migraine headache in this area. Okay, GB38 and GB43 drain liver yang from the head, especially when the symptoms manifest in the gallbladder channel. Now, GB20, GB20 ड्रेन लिवर यांग GB20 क्या करता है लिवर यांग को ड्रेन आउट करता है फ्रॉम द हेड एंड काम द लिवर विंड और लिवर विंड को शांत करता है भाई शांत हो जाओ नाउ GB21 send liver yang downward. Okay, GB21, very important work of the GB21. It send liver yang downward. The next point is the DU20. DU20 descent yang, yang को नीचे लाता है, descent yang from the head. DU20 descent yang from the head. And UB18, UB18, this is the vacuum point of the liver. So this point calm the liver. This point calm the liver. Okay. And you can give the advice to the patient. So advice given for the liver indeficiency is also applicable here. It will be advisable for the person to avoid the consuming things that create heat in the liver or cause liver yang to rise. So main thing is the alcohol will frequently have the negative impact in particularly that red wine. As a sour taste, it start network, it's affect directly to the liver. So secondly, anger causes chi to rise. So the person must try to avoid getting into situation where they can become angry. Stress will also have the negative effect. So, and exercise and dynamic activities. Okay, corrective methods, exercise and the dynamic activities will activate and spread the liver chi. Liver chi should be spread. The stagnant liver chi should be released from the liver. It should be spread out. So we have to do everyday exercise and the dynamic activities like dance, walking. Okay, this will be reduce the pressure in the liver, which may have helped to push liver yang upward. So this pressure, the pressure is developing in the liver, and it's that pressure help to force the liver yang upward. So you should do the you should practice the exercise and dynamic activities so that these activities will activate and spread the liver in. So ascending liver yang can be cause a liver indeficiency. When there is a liver indeficiency that cause the ascending liver yang, and also there is will be kidney indeficiency and liver chi stagnation. So what are the causative factor? Liver indeficiency, kidney indeficiency, and liver chi stagnation. and liver blood deficiency. There are the four characters. I am writing. Liver in deficiency. Okay. Liver in deficiency, kidney in deficiency, and liver chi stagnation. Liver chi stagnation and liver blood deficiency. These four factors are responsible for the liver yang rising. So these four factors can result to the liver indeficiency, liver fire, and liver wind. Okay, let us summarize. So hyperactivity of the liver yang. So it is a liver yang rising. So etiology is the prolonged anger. Always a person is getting anger, frustration, and resentment. And underlying symptoms are the patterns are the kidney indeficiency, liver indeficiency, liver blood deficiency, and hypertension. And what are the signs and symptoms? So headache, that is the temporal or behind eyes or lateral side of the head. And then dizziness, chakkar aata hai, tinnitus, ear ringing, fire flush with the packing heat in the face, okay, and deafness, blur vision, dry mouth, dry throat, irritability, okay, insomnia, profuse dreaming, profuse dreaming, and feeling wind up and easily angered, okay, easily angered. That person will be easily angered. And you see the pulse will be wiry or wiry and high. Okay, tongue will be normal or red or pale if liver blood deficiency present. If there is the liver blood deficiency, tongue will be pale. And treatment principle, enrich in को बढ़ाओ, calm liver को शांत करो, subdue yang. Okay, and acupuncture treatment, which I'm adding some points. Liver 3, HA5 is triple honor 5, bladder 23, SP6, GB43, GB20, and liver 2, UB18, kidney 3, extra point, Taiyang, LI4, GB38, and HA17, triple hormone 17 plus GB39. both points together. Okay, let us see the point locations one by one. Let us see the points location. Now, liver 3. See the liver 3 on the foot, dorsal side of the foot. Okay, location on the dorsum of the foot in the hollow distal to the junction of the first and the second metatarsal bone. Okay, so hollow place is the junction at the first and second metatarsal bone. Okay, this is the liver 3. See the video how to locate the liver 3 and how to prick the liver 3. Okay, friends, please tell me, can you hear the video sound? Video sound is audible? Yes, yes. Okay, thank you. Okay, let us move to other point. HA pi. Okay, this is the exact HA pi of the dorsum of the lower arm. Okay, two chun proximal to the HA4 in the depression between the radius and the ulna. Radius bone and ulna bone. Okay, in between. And two chun from the wrist crease. Two chun means three fingers. Okay, in between radius and ulna on the radial side of the extensor digitorum communis tendons. Okay, this is the digitorum communis tendons. Okay, see the video location. See how to locate. Okay, while needling this point, don't tell to patient, don't move the hand, otherwise needle should be bent. Our third point is the bladder 23, kidneys backshoe point. Bladder 23. This is the bladder 23. Okay. So location is the 1.5 June lateral to the lower border of the spinous process of the second lumbar vertebrae. Second L2. Okay. Lower border of the spinous process of the second lumbar vertebrae. It is a 1.5 June lateral. See the see this image. Okay, this is the first lumbar vertebrae and this is the second lumbar vertebrae, and this is the spinous process of the lower border. This is the spinous process. So see the video how to locate the bladder 23, UB 23. Don't needle deeply, otherwise this needle can be injured the kidney. Our next point is SP6, spleen 6. Okay, this is the spleen 6. On the medial side of the lower leg, 3 chun, 3 chun superior proximal to prominence of the medial malleolus. This is the tip of the medial malleolus. 3 chun, 4 finger proximal upward from the tip of the medial malleolus. In the depression close to the medial crest of the tibia. Okay, see the video location. Very important information. Don't use this point in the pregnancy. Avoid this point. So, in condition of the pregnancy. Our next point is the pericardium 6. This is the pericardium 6. Pericardium 6. Okay. So, see the this tendons. Okay. So, palmaris longus and flexor carpi radialis. So in between two tendons, okay, this point is located. It is the 3 2 chun proximal from the wrist crease. Okay, This is the location on the flexor aspect of the forearms, two chin proximal from the pericardium 7. Pericardium 7 on the wrist crease. It is between the tendon of palmaris longus and the flexor carpi radialis. Okay, this is the pericardium 6. Video location. Okay, when you prick this point, so electric like sensation will be reached in the middle finger. Okay, that is the indication of this point. It's correctly inserted. Our next point is the GB43, gallbladder 43. GB43. So this is the GB43, 0.5 Chun proximal from the wave of the fourth and fifth toes. Okay, so in between the fourth toe and the little toe, fifth toe, 0.5 Chun proximal to the margin of the wave. Okay, this is the margin of the wave, and zero point 0.5 Chun, 1 centimeter away upward from this margin. It is the GB43. See the location. Our next point is the GB20. So this is the GB20 on the back side of the head, at the mustard process, at the level of the mustard process. Okay, mustard process, the palpate the bone behind the ear is the mustard process. Okay, below the occiput, approximately midway between the DU16 and GB12. in the hollow between the origin of the sternomastoid and trapezius muscles. Okay, this is the GB20. See the location, how it can be located. Okay, let's discuss our next point, liver 2. This is the liver 2. It is the half chun, 1 centimeter proximal to the margin of the wave of the big toe and second toe. Okay, on the dorsum of the foot between the first and second toe. 0.5 chun, 1 centimeter proximal to the margin of the wave. This is the point. Okay, see the video location. Okay, next point is the bladder 18, UB18. This is the UB18. See the location. Okay, 1.5 chun lateral to the lower border of the spinous process of the 9 thoracic vertebrae. 1.5 chun lateral. Count the 9 thoraces. Okay, 9 thoraces. 1, 2, 3, 4, 5, 6, 7, 8, and 9. Okay, it is the lower border of the spinous process of the 9 thoracic vertebrae. 1.5 chun. Okay, see the video location. Okay, now let's see the kidney 3. Kidney 3. Okay, this point in the depression between the medial malleolus and Achilles tendon. Okay, this is the medial malleolus, tip of the medial malleolus and Achilles tendon in between. Okay. Level with the prominence of the medial malleolus. Okay. This is the level with the prominence of the medial malleolus. Kidney 3. Video location. Now let us see the extra point, Tai Yang point. See, this is the Tai Yang point. Okay, end of the eyebrow. This is the end eyebrow of the eyebrow and outer canthus of the eyes. This is the outer canthus of the eyes. It is the midway between the, this is the count. See the midway, Taiyang. Okay. So at the temple in the tender depression, okay, palpate the depression, it will be tender depression, approximately one full posterior to the midpoint between the lateral extremities of the eyebrows and the outer canthus of the eye. Okay, this is the point. See the point. Now see the location, video location. Okay, our next point is the Li4. This is the Li4. So this is the second metacarpal bone. Okay, so palpate the second metacarpal bone and take the midpoint of the second metacarpal bone. Okay, so at the midpoint, okay, see the midpoint on the dorsum of the hand between the first and second metacarpal bones, at the midpoint of the second metacarpal bones and the close to the radial border. It is close to the radial border. See the location, video location. Don't use a point in pregnancy. Now our next point is the GB38. See the GB38 point. Okay, it is a fortune proximal upward from the tip of the lateral malleolus on the lateral part of the lower leg, fortune superior of the prominence of the lateral malleolus at the anterior border of the tibia. Anterior border of the tibia. This is the GB38 point. See the video location. Okay, now our last point is the HS17, triple armor 17. Sanjo 17. Okay, behind the earlobe. Okay, behind the earlobe, between the ramus of the mandible and the mustard process. Mandible and mustard process in between. Okay, palpate the mustard process bone and the ramus of the mandible and mustard process. Okay, it is the in the depression just superior to the palpable transverse process of the first cervical vertebrae. Okay, at that level. See this. This is the mandible. This is the mandible bone and mustard bone. This is the mandible bone and mustard bone in between. See the video location. Friends, you should needle this point with the combination with the GB39. Okay, so we can see the location of the GB39 also. HJ17, triple around 17 and GB39. See the GB39. It is the four three tune proximal, four finger, three tune proximal from the lateral malleolus above the ankle joint, 3 chun superior to the prominence of the lateral malleolus between the posterior border of the fibula and the tendons of the peroneus, longus, and brevis. See the peroneus brevis and peroneus longus. See the video location. Okay. Now tell me how you like these sessions. How do you learn from this session? Who will tell? Who will summarize the session in brief, in short? Okay. Please come forward. I am going to unmute you. Unmute you all. I will allow you. Yes, madam. Carry on.
Yes, sir.
हाँ मैडम बोलिए. हाँ बोलिए मैडम. लक्ष्मी जी खुद को अनम्यूट करो. अनम्यूट योरसेल्फ.
हेलो.
हाँ यस.
सर वो गलती से बच्चे ने खोल दिया था, साइड में बैठा था वो.
हाँ हाँ हाँ.
सॉरी.
ओके ओके. कौन बोलना चाहता है?
Sir, please summarize. I just joined very late.
You can hear the video. I will post in group.
Sir, last
And
video also you have posted.
yeah, last video also I posted.
Okay, thank you, sir.
हाँ हाँ. रितिका जी
नमस्ते
क्या?
सर.
हाँ हाँ रितिका जी बोलिए. क्या अच्छा लगा आपको? हाँ जे जे कौन है ये?
सर बहुत अच्छा सेशन रहा, बहुत अच्छी जानकारी भी दी है और आपने जो वीडियो से एक एक चीज का पॉइंट बताया ना, वो भी क्लियरिटी अच्छे से हुई सर. बहुत अच्छे से आपने क्लियर किया है. थैंक यू सर.
हाँ
Sir, Namaste. I'm Jyoti Ramchandran.
हाँ बोलिए ज्योति जी.
Ji, the session was very, very good. Basically, it was very nice, and but I need to watch it again, to get the clarity of liver yang and ascending and all these things, and the points.
हम्म.
So I'll watch it. I think it will be posted in YouTube. So need to watch it again and again. So to it sits in our
Okay,
mind,
okay. हाँ, तो I will post it within 1 hour, 1 hour
Yeah, yeah.
or 2
Sure,
hours.
sure.
I will post. Okay.
Yes, sir. Very good clarification and the points. And one more thing is that I want to know is these points, whichever you have means through the video, we were explained about the points. Those videos are available somewhere in YouTube or something.
No, it is not available in YouTube. It is a special software is there.
Okay.
So, so it is not available for public. Okay, it is
So
a
how do
special
we, yeah, so
special
whenever we
software
want,
is there. Yeah,
haha, okay. But whenever we want to get a clarity of the point, some YouTube, we could go and search in YouTube, no?
yeah. You can search in YouTube. You will get the clarity. Okay.
Okay, sir. Okay,
Ah,
okay. Thank you very much.
okay. Okay. Any more?
Namaste, sir. This is Harshala.
हाँ बोलिए.
Uh,
हाँ बोलिए टिप्निश जी.
Namaskar. After
नमस्कार.
long time, sorry, I was lot busy and I couldn't attend many sessions.
Yeah.
Though I registered for it, so will be
Hmm.
now is better going. But this
Hmm.
session was very good. I liked it. And one more thing I wanted to ask is, this is we have done for the liver yang to sedate
Rising.
the liver,
Liver,
right?
you have to select all points which I mentioned.
Yeah. But what about if the liver yin is deficiency?
Liver in it is all points. I lastly I given all points, so it will be
Yeah.
work on the liver in deficiency also.
Oh, okay, okay. Because I
हाँ,
have
yeah.
my daughter. The thing is, my daughter is having nails bleed. Her so what means her nails become blue when it is cold, when and her hands will be cold. So is
Mhm.
it because of liver deficiency, liver yin
Yeah, there's
deficiency?
cold is also the spleen yang deficiency also. So
Okay,
let me diagnose her, send her tongue picture on my WhatsApp.
okay,
हाँ.
okay, sure, sir,
हाँ.
sure.
So then I will, if you are in Mumbai, so you can come in my clinic
That's fine. Yeah,
at Domboli.
yeah, yeah,
Sir,
sure.
this video is not uploaded, sir. Last time video is not there.
It's there. It's there.
I uploaded. If you are in my app, if you download my app, you will get the all video, free video.
Which app, sir? I don't know your app.
Saspandan. Send me message, ping me on WhatsApp. I will send the link of the app.
Okay, okay, sir.
Hmm.
Okay, sir. I will send you the picture.
Yeah,
Harshala
yeah.
here again. I will send you the picture and then we'll discuss
Okay.
personally. Yeah.
Okay.
Okay, sir. Sure.
Okay.
Okay.
Thank you.
So
Thank you,
this
sir.
lot
Thank
of
you.
this itching. Why, sir? The itching happens, sir. Too much of itching.
Too much it is the wind. Itching means wind. Always remember, itching means
Hmm.
wind. You have to reduce the wind. We have wind is the it is a wind means liver, and itching means it is the liver yang. It is the wind yang. It is the gallbladder.
Mm-hmm.
So what is the wind point of the gallbladder? Tell me.
Sir, I do 6 key actually.
Yeah. So if you do the Siski, so
Hmm.
sedate the wind, gallbladder wind sedation,
Okay.
gallbladder wind sedation.
And sir, like too much of skin problems, this does it solve this eczema and dermatitis,
So
atopic
need
eczema?
to need to diagnose the patient. So too much skin problem. That main etiology is the emotions. Emotions. It is the sad emotion. You observe that patient too much skin disease
Mm-hmm.
or any asthma, a respiratory problem. So that is the sadness, sad emotions. Observe that patient.
Mm-hmm.
Yeah, you
Mm-hmm.
have to work on the emotions also.
Yes.
There are the many protocols, many organs are involved in skin disease also. So, whether it is the dryness or the kidney also involved, spleen also involved, heart and liver also involved. So, what is the etiology? It is the part of the diagnosis.
Mm-hmm. Okay. And so, like, I did not attend your class this one, but what about if the pain is coming behind the ear while moving the neck?
Pain is coming behind. It may be because of spasm. It may be because of spondylitis. Maybe.
Mm.
Hmm? It may be because of liver blood deficiency also. Patient have if liver blood deficiency, so spondylitis, the cervical paining will be there.
Mm.
So treat liver blood deficiency, pain will be go.
So, like,
Sir, one
by
question.
that same lady, sir, excuse me, the same
Huh.
lady, sir, she has so much of heat that she has to take bath in the night. Without that, she cannot sleep. So much of burning is there
So much burning. So
in the whole body.
the burning is the heat. Okay.
Mm.
Okay. So heat burning in on the skin or internal burning or what. So now I can't tell you why there is a burning. Patient should be diagnosed.
But shows the tongue shows yang deficiency, but otherwise it is burning
Young deficiency is the coldness, but burning is the
heat.
that young deficiency means it's maybe a deficiency of a blood deficiency, chi deficiency.
Hmm.
So burning is that blood is not reaching the blood deficiency, blood is not reaching there.
Hmm.
Hmm? Show me tongue. Then I will
Hmm.
tell you something.
Okay.
Okay.
Sir, one more question. I'm Jyoti Ramchandran here. In place of needles, can we use chakra magnets or something like that?
Chakra magnet and needles are very different. So
Mm.
only and magnet that energy works definitely. I cannot deny.
Mm.
But when there is the needle acupuncture, okay,
Mm.
if you do that precisely while identify the patterns, that this is then result will be very quicker in the
Okay.
acupuncture.
But what about the magnets? Difference in getting the result using a needle and the magnet.
And magnet are that is the very different. When we are doing on the meridian acupuncture, so
Hmm.
magnet can be chakra magnet is the and that it is the different sedation and tonification. So
Hmm.
only needle its place needle work, and magnet is the different. So that we can physical and metaphysical uh,
Mm.
yeah, that energy we have to
Sir, but I use
identify.
simple seeds. I use simple seed for that with the instead of needle. It gives good result. I use just chana seeds.
Okay, you can use seeds, you can use colors also, you can use acupressure also. Patient will be get result, but if you have to give the permanent result, so you should go proper. Study
Mm.
should be proper.
Sir, even in the TCM classic meridians, we can use these magnets and star magnets and all, no? Seeds, they don't give result. They, of course, I found that
They
very
can
good results.
they can give you result,
Yeah.
definitely. So where you are applying the magnet or seed or color,
Mm.
they are giving result. Uh,
Yes.
but that result should be long lasting. No?
Or it should be like it may not be so instantaneously. It'll
Mm.
take some time maybe. But
Yeah, takes
needle
time.
we get very we needle we maybe we're getting quicker result.
Yeah, quicker little, but depend on what
Huh.
points you are using.
Yeah. Sir, because
As per a pattern.
while using new needles, sometimes we may not be very accurate. So in
Mhm.
that case, like it's better to use a seed or a magnet, no? Because there is no any what to say fear, while doing the treatment.
No, no, you should convince the patient. So,
Ah,
you should convince the patient. So, and
hmm,
yeah, and needling technique is the matter, na?
correct. That
Huh,
should be very perfect. Exactly.
needling technique. So,
Absolutely.
without
Hmm.
paining, you should
Hmm.
needle.
Hmm.
Okay, that is the matter,
Hmm.
na?
Yeah, yeah. Yes, sir. Thank you.
Mhm. Okay, so enough for today. Anyone? Anyone want to ask anything? Okay, thank you. So enough for today. Closing the session. Thank you very much.